Amen.
Okay.
Alors, du chef, bonsoir à tout le monde. Nous avons invité nous à soir, c'est Véronique Delva, mais non, comme c'est Nikki Delva, qui c'est un genetic counselor. Il était là ensemble avec nous déjà sur plateforme là et je veux dire il retourner pour lui parler nous plus qui importance que nous-mêmes nous connaissons qui ça cancer génétiquement qui ça que lié. Alors Nikki premièrement parler anglais, il comprend créole, il parle créole tout, un créole qui pas fait trop correct mais li ka pale, alors que map là, c'est pour faciliter la communication plus rapide, plus fluide au besoin. Alors, Nikki, tu as la parole.
Thank you so much, my mother, my dear mother. I'm so happy to meet with you guys again to just talk more about cancer genetics and why it's relevant for really all of us. I'll pretty much review a lot of the stuff that we spoke about before. I've added a little bit more stuff, but I'm excited to talk about this topic. We have an opportunity for questions at the end. But I'm excited to hear from you guys and to share as much information as possible.
Okay, so good.
Okay. So today, this is really what I want to talk about. Just what is cancer, different sort of things that we can do to screen or prevent cancer. What is the point or the correlation between genetics and cancer, and cancer genetic testing? Who should get it? What's the point of getting it in the first place? And then I have some examples and then questions at the end. Okay, so what is cancer? The age-old question. Essentially, cancer is just uncontrollable growth of your cells. We all have millions of cells in our body, and they're dying constantly, and they're also growing constantly. But sometimes those cells, due to different sort of factors, can start growing uncontrollably and can lead to this growth that in turn turns into a tumor that can lead to cancer. Cancer is an invasive species that essentially comes into a place, takes over it, and makes things very difficult to function.
Ok, qui ça cancer lié? Ma PC récapituler qui ça dit, yon, c'est cellules yo qui juste développé sans contrôle. Et le développer comme ça, nous, yo aller le rythme que yo pas qu'à contrôler et c'est yo considère que son espèce qui est invasive. Nous dans le corps nous avons des milliards de cellules mais le yo aller comme ça yo sans contrôle yo développer yo vinn leur dimension que nous pas qu'à contrôler c'est partie ça yo même qui grossit, pas grossit, non, qui développé, sans contrôle, c'est ça que yo pratiquement relé un cancer.
And so, what exactly causes cancer? So, aging is a pretty big risk factor to develop cancer. As we all know, as you get older, your body just does not work like how it used to. As your cells are growing and dividing, mistakes can happen. And that's just a result of aging. Your body's not able to regulate or see when things go wrong. And those mistakes might go unnoticed until it turns into that uncontrollable growth.
Il y a plusieurs causes de cancer. Première, c'est l'âge. Euh, Malheureusement, n'a grandi, n'a vieilli, euh, cellules yo pas effet que yo pour yo ta guerre, yo pas guerre encore. Et pourtant, si a pu grandir, c'est ça que fait l'âge. Et le monde a entré en âge, c'est une nan cause cancer.
Other factors include environmental factors, so somebody's diet, whether or not they have a history of smoking or drinking excessive amounts of alcohol, different sort of environmental exposures, such as like being exposed to 9/11. We know people who were at the 9/11 site. people who were exposed to Hiroshima in World War II, other things, those things can lead to someone getting cancer as well.
Gen lot bagay, jan nou manje, okazone kanser, si nou fume pou un paket tan fume ou bien bwe al ekse, e pi eksposyon lan
Oh,
environman.
thank you. Very nice of you. Oh, I lost it.
Paske nou e gen de moun ki te ekspose la 9/11 New York, ou bien lot kote yo, ou bien ki la Hiroshima, e pi asbestos ki la tout bagay sa ou kontak le nou expose an seri de substans koze kanser to.
There's also things that when you're born with can also put them at a high risk to develop cancer. So things you have no control of, things that were passed down from either your mother or your father that put you at a much higher risk to develop cancer from the start. And that's what we call like a hereditary risk.
Gen de risk hereditaire ke nou pa ka kontrole, ke maman, papan, ban nou, pase ban nou, e nou pa gen ouke kontrol de yo menm, ki ka yo menm tou koze kanser.
There are also other things like infections, hepatitis puts someone at a higher risk for liver cancer, HPV, puts women at a higher risk to develop cervical cancer. H. pylori is an infection that people can have in the lining of their stomach that can also put them at a high risk for stomach cancer.
Gen se de infeksyon tou ki koze kanser, hepatit, HPV, H. pylori, se de maladi e de infeksyon ki yo menm tou ka okazyone pou moun ka gen kanser.
And also hormonal or immune imbalances can also put someone at a risk.
E nou gen se de sistem immuniter nou ki pa kodjom, ki pa balanse, tout sa tou ka koze kanser.
Today, we'll kind of talk a little bit mostly about hereditary risk, but also other sort of risk factors as well.
Nap konsantre nou sou parti herediter la, plus ke lot fakteur.
So first, I'll ask a question. If you guys were here last time, you'll remember the answer to this. I added another question too, but what do you guys think the average woman's risk is to develop breast cancer over the course of their lifetime? Would you say it's 1 to 2%, 10 to 13%, 25%, or 44%?
44%.
Okay. Anybody else?
I would say C, 25%.
Okay, anybody else? All right. And I'll ask one more question. What do you think is the average man's risk is to develop prostate cancer? So 1 to 2%, 15 to 18%, 25 to 30, or 45%?
45%.
Hmm. Anybody else?
1 to 2. Oh,
Anybody?
prostate. Oh, sorry.
Oh, people are in the chat. Sorry. Okay, BVC. Okay. All right. So you guys were wrong. So actually, for breast cancer, it's around 13%. So around 1 in 8 women will develop breast cancer over the course of their lifetime. I know sometimes that number can seem low just based off people's friend groups, based off their personal history, who they know. But just statistically speaking, at this point, it's considered to be 1 in 8. That is still pretty high when we think about statistics. If we think about the amount of women who are in this chat currently, that's a good amount of people that could potentially or might have already had a diagnosis of breast cancer. And then for prostate cancer, it's actually much higher. So it's around 15 to 18%. So instead, it's around 1 in 6. Unfortunately, also for prostate cancer, we know Black men are at a slightly higher risk to develop prostate cancer compared to other groups as well.
Repons pou dapre statistik yo, se yon sou chak 8 fi ki ka gen kanser du sen. Ki 13%, ki yon ti jan wou, le nou, par exemple, si nou konen la fami, l'eglise, nou moun ke nou konen, si nou konen 2-3 moun ki fe kanser, men sou point statistikal, li pa osi wou ki sa se yon sou 8, men pou les hommes, li jusqu'à 18%. Sou chak 6 garçons, yon au moins ap gen kanser du prostate.
And here are just some other statistics about other cancer types. So colon cancer is also getting a little bit more common, around 4%, lung cancer, uterine cancer, thyroid cancer. Some more rare cancers include cervical cancer and ovarian cancer.
Ouais, nou ka wè statistik yo sou graf la, kote kanser du kolon, sou 26 moun, ap gen kanser la, epi kanser ouver, epi tout lot kanser yo. Si mgo kesyon mboze ni ki, statistik sa li baze pou fi e gason, pa vre?
Yeah, these are for men and for women.
Ok.
So for like male breast cancer is much lower. It's around 0.01%. But
Mhm,
yeah, for like cervical, that's just women, ovarian, uterine, just women. But for the colon, lung, and thyroid, those are for men and women.
mhm, ok. Uh, uh, Marie-Josée dit not prostate.
Yeah,
Um,
yeah, prostate is not that's exclusive to men.
Ok. Nou gen kanser du prostate, se garson ki gen el, epi kanser du sein, se fi, kwa ke gen 0,01% de garson ki gen kanser du sein tou, bot gen de kanser ki tipikman asosye a fi, kanser cervix, ovaire, uterine, sa ou se pou fi, epi men kanser poumon, glande thyroïde, tout ça, c'est tout le monde, pour humain.
Okay. So what do we do about this? There's a U.S. Preventative Services Task Force that has gathered all this information and they've set out these national guidelines for people to follow so that we can address this high risk of cancer. At this point, there's not a surefire way for us to cure cancer, because it is a very personalized approach. But we do offer high risk screening, or just screening, which is like for starting for at the age of 40, women start getting mammograms. Women start getting cervical exams or pap smears between the ages of 21 to 65, colonoscopies. If people have a history of smoking, then lung cancer screening starts at 50. And then for prostate cancer, that starts in their late 50s as well.
Ça, c'est juste, c'est un task, une force des États-Unis qui peut essayer un task préventif pour cancer, juste pour nous tester avant, pour nous connaître là qui est-ce que nous gagnons ou pas. Pour cancer du sein, yo suggéré filles à partir de 40 ans, yo commencer à faire mammogramme, puis yo ka connaît pour cancer cervix, tout dépend de mon an, yo commence de 21 ans jusqu'à 65 ans. Tout dépend des types de cancer que vous cherchez, hein. Cancer, poumon et côlon, avec prostate cancer, tout ça, c'est des suggestions que le gouvernement, task prévention, hein, gagne pour pour le monde, te ka commencer à faire tester pour qu'on est-ce que y a possibilité pour te ka gen cancer.
As of right now, these guidelines are certainly not perfect. I'm sure you guys may know of women who were diagnosed with breast cancer before the age of 40, or people who are diagnosed with colorectal cancer before the age of 45. It's not perfect, and this is only screening for 5 different cancer types. So obviously, there are other cancer types that might benefit from having screening, but as of right now, we just don't have any nationally recognized ways to screen for them.
Si vous comprenez, c'est peut-être 5 types de cancer ça yo que nous ka screen moun, pas pour l'autre cancer yo. C'est ça ou dit?
Yeah, so as of right now, there aren't really any established guidelines for screening unless someone had, like, for the general population. Like, the general population wouldn't get screening for other types of cancers unless they have a very significant family history or a personal history or something like that.
Présentement, yo offri que te ka checker pour seulement 5 types de cancer ça jusqu'à présent pour cancer du sein, cervix, poumon et autres, prostate. Mais ça va veut dire que c'est ça que communément c'est ça que vous fait pour moun tester. Mais si gon moun, à moins que au monde li genye yo suspect que la famille li ka gen cancer, yo ka fait tester pour lui, mais sinon c'est 5 ça peut gen. Bien entendu, ça, statistique, ça qui dit que le sujet pour me faire commencer à faire mammogramme à 40 ans, c'est juste un statut généralisé. Quoique peut-être nous-mêmes, nous avons des gens, par exemple, qui diagnostiquent de cancer du sein bien avant 40 ans. Mais c'est juste généralisé à partir de 40 ans, le sujet pour le monde commencer à faire un mammogramme pour vérifier s'il y a un cancer du sein.
And so, what are other ways that we prevent cancer from happening? So, as I just reviewed, really screening is the most effective way. We don't have a way to cure cancer at this point, so really earlier detection is key. If we find cancer much earlier, it improves your outcomes considerably. I know you guys might know people who might have passed away from cancer or other sort of things. Oftentimes, it could be an aggressive form of cancer. Other times, it could be because cancer was caught much later than we wanted it to.
Cancer pas de traitement, malheureusement, jusqu'à présent, nous pouvons gagner. C'est ça qui fait que chance qu'on moun gagne, c'est si on tra journée avant, pendant que est le stage pour la développer, et puis ça t'est qu'à bon, parce que c'est pas pour dire ou on tête fait, mais on va penser à donc pour lui, ou guérir. Il faut qu'on gagne un traitement, ni un médicament pour guérir cancer.
Also, eating healthy, regular exercise, limiting alcohol intake are ways to prevent or lower somebody's risk for cancer, as well as genetic testing. Unfortunately, though, even if somebody does all these things right, it doesn't mean that they'll never get cancer throughout the course of their lifetime. Unfortunately, a lot of my patients eat healthy, exercise regularly, might never consume alcohol, but still end up getting a diagnosis. These are just helpful ways to hopefully lower your risk.
Bien entendu, c'est suggestion que y a ban nous, professionnels, yo, manger bien, faire de l'exercice, réduire la consommation d'alcool, nous, et puis tester génétiquement. Mais malgré un pile monde, pour toute précaution ça, yo, gen qui, malheureusement, gen un cancer là, quand même. Ça veut dire que c'est juste suggestion que y est, mais c'est pas pour dire, si nous suivons tout bagage ça à la lettre, yo garantit nous que nous pas bien cancer.
Okay, so what are genetics and cancer? So cancer is really split into three separate parts. We think about hereditary cancer, which is only a small piece of the puzzle, which makes up 5 to 10% of cancers. Then we might see familial cancers. That makes up a slightly bigger piece of the puzzle. We would say it's 20%. And then there's another portion that makes up the largest majority of the circle, which is sporadic cancers. For sporadic cancer, that just means that this is a cancer that just happened randomly, and we do not have an explanation for why it might have happened. Familial cancers are cancers where we might see clusters in the family. So, multiple family members might have the same type of cancer, whether it's multiple people in a family who have a history or certain exposures. They might have been exposed to the same things or consumed the same things over the course of their lifetime that could have put them at a higher risk. And then there's hereditary cancer, which is something where someone was born with something and has an inherited factor that contributed to their risk of developing cancer. That was a lot.
Ah, non, pas vraiment. Non. C'est juste pas comprendre la différence entre familial cancer and the hereditary cancer.
Yeah. So basically, for the familial cancers, we can do genetic testing and we don't find an explanation for what's going on. We can see a family history where there's a lot of people who have colon cancer, and we do genetic testing to see is there something that they were born with that could have led to all these people in the family developing colon cancer, but we don't find an explanation. Again, only 5 to 10% of cancers are considered to be hereditary, meaning that there's something that we find that explains what's going on. But familial is when we still see a lot of people in the family with cancer, but we don't have a genetic or a hereditary explanation for why it's happening.
OK. Yo divise cancer en trois parties pratiquement. Gen cancer bon, familial là, c'est peut-être là yon famille, yo ka wè un type de cancer que plusieurs membres de la famille l'ont gagné, mais il n'y a pas d'explication pour ça. Il n'y a pas aucune explication, mais seulement il y a ouais, que plusieurs monde bien même type de cancer là. Alors que cancer héréditaire là, le fait test génétique pour mon nan, yo ka déterminer que le qui gène, le qui côté que yo plus ou moins une raison, une explication plutôt côté cancer là sorti, là qui c'est gène parent ou bien côté le sorti. Ensuite, cancer sporadique, là, m'ka dit c'est juste un cancer qui prend mon par surprise. Il a juste été cancer dans venu sans que yo pas ouais que c'est juste on dit mon cap jouer par chance et puis yo voit et puis dé a tombé sous et puis ou gen cancer là.
And this is just a visual to kind of show what inherited cancers might look like, where you see multiple generations might be impacted by the same type of cancer. In that case, it can either be hereditary or familial cancer.
Si nou gade nan ti foto ti tonton yo, nou wè kote kanser ki an swa familial ou bien héréditaire là, kote ke gen plusieurs membres lan fami lan ki gen el, epi kote pou sporadik la, son un seul gen nan ki gen el, sa ke par an kote l soti, epi l tombe sou moun sa.
So the things that typically make us concerned or are red flags for us to maybe be suspicious that somebody has an inherited cancer is one, when we see a lot of people in the family with the same type of cancer. If we see certain cancer types run together, so like breast and ovarian cancer, colorectal cancer and stomach cancer, certain subtypes of breast cancer, like triple negative breast cancer, makes us concerned that there's something genetic going on if someone has breast cancer in both of their breasts or breast cancer more than once.
Sa ki kon fè nou prete atensyon si yon kanser familial ou hereditaire, se si ke moun nan, par exemple la fami, nou e gen moun nan gen kanser du sein, ou bien li gen ou lot kanser, ou bien kanser uterine, ou bien ovaire, ki jis rapproché a, bon, I mean, I'm not a technician, I'm not in the medical field either. So, nou ka wè ke gese de bagay ki rapproche lan organ moun yo ki plus ou mwen rapproche yo ka kompren ke se li hereditaire ou bien li familial. Et puis, ou bien tak aussi, par exemple, moun nan gen kanser lan led de sein, ou bien gen sub kote lan ko sein ki te ka gen el tou. So, uh,
Yeah.
bon, tout sa, se sa ke yon ka determine. Gon kesyon konen ane ki mpa konen sou apre pone,
Yeah.
while
Oh, sorry.
black men, or should we wait after, or you wanna answer
No,
this?
I can answer. Sorry, I just don't see. Oh, after.
You'll do it after.
Yeah. Sorry, I don't see the chat for some reason.
Okay.
Okay. Also, younger ages of diagnoses also make us concerned when if someone gets diagnosed with breast cancer in their 80s, we're less suspicious compared to somebody getting diagnosed with breast cancer in their 30s.
Would you say it again? Sorry.
Yeah, younger ages of diagnoses for cancer also makes us suspicious. So somebody being diagnosed cancer in their 30s is more suspicious than a woman being diagnosed with breast cancer in their like 80s.
Le plus jeune, l'an âge que yon moun yo découvri li gen diagnosis cancer, fait que yo plus suspect. Par exemple, si yon moun entreten li yo découvri li gen un cancer du sein ou bien quelque chose cancer là, pour apporter yo à questionner famille là pour ça, au lieu que c'est plus tard, disons moun nan 80 années, et le sal ta vin développer un cancer.
And so this shows a little bit more about the hereditary risk versus general population risk. So, generally speaking, most the general population risk for some of these cancers are shown in the dark blue, whereas if somebody is born with some like a gene mutation that puts them at a higher risk to develop cancer, that might be seen in maybe the lighter blue color. For instance, I don't know if any of you guys have heard of the gene BRCA or BRCA before. Do you want to go? Oh, well,
Okay.
well, okay. So with BRCA, it is associated, it's called hereditary breast and ovarian cancer syndrome. And it puts somebody at a higher risk to develop breast cancer, ovarian cancer, pancreatic cancer, and for men, prostate cancer. This kind of shows how high their risk might be to develop those types of cancers compared to the general population risk of those same cancers. So, for instance, if you look at the breast column, general population risk is around 12%. If somebody is born with their BRCA gene not working, their lifetime risk to develop breast cancer could be as high as 87%, which is very, very, very high. Um, for the ovarian cancer risk, it can be up to around 40, 50, in some cases 60%. And then for pancreatic and prostate, their risk is also increased. Kiga?
Say it again, please.
Okay, okay, okay. So basically, this shows the general population risk for certain cancers compared to hereditary cancer risk. Hereditary just means that somebody was born with something that was passed down from their mother or their father to put them at a higher risk to develop cancer. For an example, one of the hereditary risks that we know of is related to a gene that's called BRCA or BRCA. It's primarily associated with breast cancer, ovarian cancer, pancreatic cancer, and prostate cancer. And this is just a chart. It includes colorectal and uterine that's not associated with BRCA, but this is just a chart to show how high somebody's risk might be compared to the general population if they were to have a hereditary risk for cancer. Um, for instance, the general population risk is around 12% for all women to get breast cancer. But if somebody's BRCA gene isn't working, their risk to develop breast cancer could be as high as 87%. And so
Okay.
that information is valuable to know because if you know that your risk is 87%, there are things that we can do about it to hopefully address that. And if you do get cancer, we are hopefully able to catch it much earlier.
Si nou ap gade chema sa la, nou genyen ki bleu ki pi fonse an avek bleu pal lan. Bleu ki pi fonse an, nou ka we ki yo chif yo pi ba ke bleu pal lan. Sa ye, se ke moun an bleu fonse yo se sa nou rele, se moun an general, populasyon general lan, ki, 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 ki geye posibilite pou ta ye kanser komparativeman avek moun ki genetikman gen jen ke li BRCA, BRCA, ki englobe sen, over, pankreas avec prostate. Alors que, on nous dit que, on prend pour sein, le nou gade sa ki bleu foncé, li gen 12% de chance pour population générale pour ta gen cancer du sein. Alors que si n'importe moun que yo, qui t'a déterminé que BRCA qui gène li pas fin travail, j'en t'a supposé travail, qui ont génétiquement que cellule que moun gen dans lui-même, ça veut dire moun ça, la gen 87% chance pour te ka gen cancer du sein. Et si nous continuons à regarder pour utérine, les 2 à 3, alors que pour cancer utérine, les monte jusqu'à 60%. Ça veut dire que on monte dans la population gain possibilité pour te faire un cancer, mais le gen BRCA nan ou même qui passe travail, j'en suppose travail là, risque là tellement haut que les conseillers pour nous aller un génétique counselor à temps si on a déterminé. Si nous connaissons que nous gen BRCA nan nou menm ki pa fin travay korekteman, nou pon de sa nou kal wè, yon nan profesyonel sa yo atan pou te ka determine ki sa ki nou te ka fe pou au mwen fon sort de preventif, on ba preventif pou nou ka privet, on se do a ki pou ta arrive nou, et peut-être aider nou mye avan ke ba yo ta fin de gengole.
Exactly. And just as a reminder, if you think about your own personal family history, your own history, just thinking about the people in your family, do you have multiple family members with the same type of cancer? Was anybody diagnosed very young? Were they diagnosed with cancer more than once? These are things that, you should ask your family members to be aware of so that you know this information. Because not only is it helpful to just be aware of it, but it's also helpful for your own health. If you have children, siblings, etc., it can be valuable for a lot of people in your family.
Par exemple, li ta bon ke nou ta fè un ti egzersis pou nou investige la fami nou. Eske gen moun na fami nou ki te gen kanser tre jen? Eske gen la fami nou ou bien se moun ki gen diferent tip de kanser? Ou di mwen, eske nou gen, just pose se kesyon, eske plizye la fami nou gen menm tip de kanser? Se des informasyon ke si nou gen yo, nous qu'à utiliser pour nous-mêmes, pour qu'à prévenir pour nous-mêmes, pour nous-mêmes, pour petites nous et génération qui va venir.
And it's also perfect timing to do it now, given Thanksgiving is next week and people might be with their families. So these are just questions to think about.
Pendant l'époque fête yo k'ap rentre là, c'est une meilleure façon que nous te ka questionner famille nous comprendre tonton un tel te mouri, ma tante un tel te mouri, grand-mère un tel te mouri par quelle façon si yo te gen cancer, quel type de cancer que yo te gen parce que ça te ka au moins nous gon idée la famille nous qui quantité de monde qui était malade et quel type de cancer que yo te gen.
So how do we find out if somebody is at a higher risk to develop cancer? That is through cancer genetic testing, and I'll talk a little bit more about that.
Façon pour nous ka connaître qui monde qui a risque de cancer, c'est juste faire test génétique pour cancer.
So who can offer genetic testing? That's something that can be offered by your OBGYN, your primary care provider, a cancer genetic counselor. All these people can help offer those services.
Qui monde qui a fait test ça pour nous? Nous docteur primaire nous, obstétricien nous, gynécologue nous, ou bien on monde même Jacques Niki qui ont conseiller de gènes.
What actually is the genetic test? So it's just a blood test. We take two very small vials of blood. They're like this big. And essentially, what we're doing is we're looking at your DNA. We're looking at the genes that you were born with, particularly your cancer genes, and we're looking to see do they work as they should. If they don't work, then that could let us know if you're at a higher risk to develop cancer and what exactly we should do about it.
Comment on fait test là? C'est deux petits tubes petits ça que vous prenez, et puis vous regardez ADN nous, regardez est-ce que, mais particulièrement, il y a concentré sur cellules cancéreuses, yo. Vous regardez qui ça y est, et puis vous avez déterminer qui ça, pour vous prendre une approche avec nous-mêmes pour parler avec nous.
When can you do genetic testing? You could do it at any point. If you have, you can do it now. You can have it if you have a personal history of cancer. If you had cancer several years ago, you can do it in the future. At any point, it's okay to move forward with genetic testing.
Et nous avons fait un test génétique à n'importe qui le connaît, si nous avons un cancer dans le passé, ou du moins quelques années auparavant, ou bien si nous voulons retourner pour nous faire à l'avenir, n'importe qui le que nous voulons, nous avons fait test ça.
And where can it be performed? Sometimes you can have video visits with a genetic counselor. They can send you also just a tube to spit in. You can ship the tube back. They send you a prepaid label. And then from there, your results take about 3 to 4 weeks to get back, and then they would talk to you about those results.
Did you say spit? I thought it
Yeah,
was.
so they have, yeah, you can go in person and you can get a blood draw. Sometimes people, aren't maybe close to a hospital or to a big hospital that has genetic services, so they can do things through video as well. And they would send them like a kit to their home. They can spit in a tube, get the results back as well.
Qui côté nous avons fait test là? Nous avons fait les, aller au centre pour nous faire, tout comme nous avons relé au centre, il y a pas le voyer, on quitte là pour nous la caille, nous. N'a juste mis un petit crachat là-dedans et puis n'a voulu le tourner. Ça veut dire qu'il a fait test qu'a fait soit par avec ça non ou bien avec crachat puis qu'a fait analyse pour nous.
And why do you do genetic testing? It's to see if you're at a higher risk to develop cancer compared to the general population. I know we spoke about all the different cancer screening that the general population has, and sometimes it's simply just not enough. Sometimes, if someone has a genetic predisposition to develop cancer, it might mean their screening starts much earlier. It might mean instead of just getting a mammogram, you get a breast MRI too. It might mean that you get colonoscopies more often than every 10 years, but maybe every other year.
Et pour quelle raison nous faire, c'est juste pour déterminer est-ce que nous avons tendance pour nous à développer cancer. C'est vrai, nous te dit que il y a seulement 5 types de cancer qui généralement ils testé monde pour ça, mais ça ne veut pas dire pour autant que pour ne pas faire. Par exemple, si que au monde qui fait mammogramme, peut-être chaque 2 ans, bien 1 an, il te doit à le faire le plus souvent, et puis tu as un qui fait colonoscopie, tout, au lieu de 10 ans pour faire, ou qu'à faire plus rapidement, au lieu de 10 ans. Et ceci, c'est juste pour qu'à déterminer qui est-ce que le risque pour le cancer là, li élevé la CAO comparativement avec la population générale.
Okay. So this kind of talks about everything that we spoke about before. Most genetic testing is covered by insurance. There's certain criteria that has to be met, but generally genetic testing has become significantly more affordable, and I'll talk about that as well.
Nous t'ai parlé de ça avant. La plupart de assurance couverture médicale yo couvri, yo payé pour test pour test ça et moi après ban nous plus explication tout sur ça.
This also just shows another example of a family history that might look suspicious. So the circles are for women, the squares are for men. This is a patient named Jenna. Her mother had breast cancer, her father had colon cancer, but you can see her aunt also had breast cancer, her uncle on her dad's side also had colon cancer. As you can see, there are multiple people in the family in multiple generations that have the same cancer type, and stuff like that would make us suspicious and warrant genetic testing.
Si nous regardons l'image ça euh, ça
The
c'est
circles are
l'âge
one.
et
Yeah.
l'âge 42 ans.
Yeah. That's like the patient.
Ok, nous avons un Gena qui côté petit flèche là, sur lui-même, là, c'est lui-même qui patient à 42 ans d'âge. Nous est que il était gagné,
Her mom has breast
ma-
cancer and her dad
maman,
has colon.
maman te gagné cancer du sein, papa te gagné cancer et colon, oublié comment dire colon, mes amis. Te gagné cancer colon. Somebody help me please. Ensuite, li gen ma tante li, qui te gen cancer tout, et puis tonton qui gen cancer. Ça, on passe de que qui vini, la vin ouais en génétique cancer, qui explique tout bagay ça yo, c'est sûr qu'il y a pas un petit temps pour discuter avec Gena qui s'est passé parce que il y a trop moun dans famille qui te gen cancer, différents types de cancer.
These are some genetic testing companies that offer genetic testing, just so that if you ever see it or if your doctor ever mentions it to you or on your lab, these are just some of the names. All of them are reliable testing companies. So Ambry, Invitae was recently bought by LabCorp, Natera, as well as Myriad. They're just all genetic testing names, just so that you can get familiar with what these labs might look like.
Ça, c'est une série de laboratoires qui fait test ça yo. Si nous nous même pensé c'est pour États-Unis, pas vrai que
Yes.
c'est pour ici aux États-Unis que y est Embry, LabCorp, Invité, Myriad, Génétique et Natera, Invité et Embry. Récemment, LabCorp, il y a autre sous en base de LabCorp, c'est LabCorp qui prend de l'autre compagnie ça, mais c'est
No,
des
just LabCorp just took Invitae. That's it.
Oh, but Embry is okay. LabCorp prend en contrôle invité, mais toutes c'est des laboratoires qui réputés et renommés pour te faire un test génétique pour nous si nous avons besoin.
So thinking about actual testing costs. Years ago, testing used to be thousands of dollars. Now they do have a capped self-pay price that's around $249 to $250. You can look at hundreds of genes for that price, or you can look at one gene for that same price. People also go through insurance. As I mentioned before, most testing can be covered by insurance. But usually insurance covers the cost of testing. Also, most of the labs that I mentioned before do have patient assistance programs that are helpful programs where they usually also cover the cost of testing. As well, most of the labs also have like payment plans. So you wouldn't have to pay maybe 250 up front, but maybe you could pay like $25 every so often.
An ki pri pou an test kon sa koute lontan, li te kon des centaines de dollars, ou peut-être jusqu'à un $1 000 kon sa, eksize, mais kon y an maksimum pou moun pe pou test sa, se $250 Ameriken, na pali pou isit Etats-Unis. Men majorite de asuransyo peye, yo kouvri servis sa. Ensuite, an pil nan laboratoire sa ou bien l'hôpital sa yo ba assistance a pasyen ki pa ka peye, gen de program ki gen etabli pou sa. En plus de sa tou, si ki ou pata gen $250 pou ta peye, ya fe aranjman de paiement ansama avek ou ka peye 10-15 000, se pa ke lo al fe test sa, ya pren 250 la avan ko servis an ba ou ka fe aranjman de paiement ansama avek ou.
This basically also talks about what I mentioned to you guys before. You can essentially customize the test to look at whatever you want to look at. You can look at breast cancer genes, colon cancer genes, stomach cancer genes. And again, it is just a blood test with a 3 to 4 week turnaround time.
Ta le ambliye di sa, le nou fe test, nou ka cheke pou un seul gen, tout kom nou ka konte pou un centaine de gen pou te ka cheke pou nou, te bliye sa. E koman pou ka fe, nou ka pren un test san, le nou pren test san, nou ka cheke kelke swa ke se poumon, si se ren, ou pa ren, non, kanser de sen, nou ka just fe cheke sa.
Yeah, kind of emphasizing what I mentioned before. It's really a preventative tool. Um, Also, you can do cancer genetic testing if you have a diagnosis of cancer. Sometimes that can help inform what sort of treatment plans you might move forward with, what sort of surgery you might decide to pursue. But ultimately, you can do cancer genetic testing at any time.
Ok, pou kanser la, nou wou lot kesyon ko par ayon ni ki mote sou chat la ke m apli pou wot alè. Nou ka fe test yo a depot ki lè. Pou test kanser la. Nou ka fe a depot ki lè ki nou bezwen.
Okay. Um, There's also direct-to-consumer genetic testing. I would say it's most reliable to get genetic testing at like a hospital or a clinic. So they have things like 23andMe where you can get genetic testing. Um, if concerns for privacy, which they should be, are concerned for you, I would advise against using direct-to-consumer testing. And instead going forward with like going to a doctor's office because you know your information is protected.
Are you saying the 23andMe would be a direct to customer testing?
Yeah, that's
Mm.
that's something that you pay like a flat rate and they'll do that. But I don't know if you guys are aware, like recently in the news, they were sold to a different company, and so people's private health information were at risk of being available just to like millionaires.
So you would discourage somebody to go through these?
Yes.
Ok. Nou genye plizye lot entite ki fete santo, gen 23andMe, ki fel tou, ki se pa ke test ou pa bon, men jist pou privacy, non? Li ta preferable si nou gen yon doktor ou bien nan li lon sent hospitalye, nan li doktor non, ou bien yon sent de genetik pou nou te ka fe test lan, parce que juste pour nous-mêmes, pour jouer information par nous était confidentielle.
I understand how the convenience of direct-to-consumer testing, it is very convenient, and that's the point. But in terms of reliability and the amount of stuff that you can get, going to the doctor's office is a bit more reliable.
Li yon ti jan embêtant pour al kay docteur, li pi fasil, pi konvenyen ou juste aller là, ou juste ou rele, on compagnie ou vin fel pour ou. C'est vrai, mais l'Italie plus fiable, si que nous aller là, un docteur ou bien un centre hospitalier qui est reconnu pour ça, pour nous faire un genre de test comme ça.
And we basically talked about this too. In some cases, if you know that you're at a very high risk to develop cancer, preventative surgery might be indicated or preventative treatment might be offered, apart from just high risk screening.
Ok, si nou ka kompren, si nou gen risk, un gran risk de kanser, nou ka fonse de bay se de prevensyon ki te ka ede nou la sa.
Okay, so I have a true or false question, which I also asked last time, but I just did genetic testing. My results are negative. This means I'll never get cancer. True or false?
That's false.
What does everybody else think? All right.
Menti.
Exactly. False. Exactly. Yes, as I mentioned before, hereditary cancer only makes up 5 to 10% of cancers. If we go back to that original pie chart, most cancer just happens sporadically or randomly. We don't have an explanation for why it happens. Really, the value of genetic testing is to see if you fall into that little piece of the pie. Because if you do, there's a lot of valuable information a lot of valuable things that we can do about it.
Li pa vre du tout, si ou te fon test kanser, li pi li negatif, e pi ou di, ok, mba ble mge kanser ankon. Parce que test ke yo fè an, se seulement 5 à 10% que au cas compter sur lui, tout 90% rete. Ça veut dire que c'est pas, c'est juste, ou juste rive comme ça, que cancer l'en vient tomber sur, ça veut dire que li pas vrai du tout si que nous connaissons, nous te font test qui est négatif, l'important pour nous qu'à continuer, checker sur ça.
So, just some last minute things to consider. So, not all cancer is considered to be hereditary, just like we spoke about before. So, genetic testing isn't everything. It's a nice portion of the piece of the puzzle, but it's not everything. Um, for the insurance coverage for cancer genetic testing, sometimes there could be an out-of-pocket cost, and we kind of covered that too. I'll review Gina in a second, but there could be impact to other family members. If you do genetic testing and you find out that you have something genetic that's putting you at a higher risk to develop cancer, it might mean there's a high risk also. There would be a 50% chance you could pass that down to your children, 50% chance your siblings could have it. So it'd be valuable for other family members to get screened and tested as well.
C'est pas tout cancer qui est héréditaire, c'est seulement un type, li vraiment minime quand il moun qui gen cancer héréditaire là. Nous te parlé que assurance couvre test yo, mais nous parlons parler tout à l'heure de GINA qui sont testés et tout, mais il faut connaître que l'important que nous connaissons si on bagage anormal dans nous-mêmes, qui a un prix pour ça, mais nous connaissons que à la fin des fins, la aider nous, la aider famille nous, et petite nos familles nous en général, si que nous qu'à découvrir à temps, si nous gagnons une maladie de cancer.
Um, In addition, we know that if someone does have a genetic risk to develop cancer, there's a lot of things that come with that. It can be an emotional and psychological burden to know that you're at a very high risk to develop cancer, even if there's ways that we can screen for it. It might mean you get screening every 6 months. The screening tools that we use might put you at a high risk to get like biopsies just because it's extremely sensitive and that can cause a lot of anxiety and fear. So there is a lot of psychological impact that can come back if someone's positive.
Nous comprenons tout, gain des conséquences ou bien impact qui arrive au monde, leur fin tester, yo wè que li positif que pour li que li prendre pour te ka gen cancer. Psychologiquement ça a bon effet sur nous-mêmes. Ensuite, gen se un paquet de tests que a fait, on sait de tests après, fait biopsie, fon se de bagay qui agi sou nou, agi sou fami lan tou.
And lastly, so GINA, it's actually a law. It stands for the Genetic Information Non-Discrimination Act, which essentially means that your health insurance and your employer cannot discriminate against you based off your genetic test results. But this protection does not apply to life insurance, long-term care insurance, or disability insurance. So,
Gen,
yeah. So basically, if you do genetic testing and you come back with something positive that says you're at this high risk to develop cancer, nothing will change with your health insurance, nothing will change with your employment. But if you don't already have life insurance, long-term care insurance, or disability insurance, you could have difficulty getting it in the future because they can treat that as a pre-existing condition. To say that you have this higher risk to develop cancer, they could reject you from getting life insurance in the future.
nou gen JINA, G-I-N-A, ki se yon proteksyon ke yon moun ki fe test lan e yo dekouvri li gen yon risk ki tre eleve pou te kage kanser, wap gen proteksyon pou travay, ou pas yo travay ou pa ka revoko pou sa, ni ke sou te gen tan gen asurans medikal, yo pa pal peut-être ou gen yo wek ou gen trop eleve pou gen kanser pou yo ka augmente se li. Néanmoins, si que à un moment ça que information an li connue ou parle de une assurance de vie par exemple, yo ka agi pour yo ka même pas bon assurance an, si le kon information ça parce que c'est à considérer son c'est pre-existing condition que yo ka utiliser pour yo te capable di ko pa éligible pour te ka gon couverture pour assurance de vie et autres.
All right, so that is all that I have. Any questions? I know we have a few questions in the
They are two here.
okay. And
Um,
also I just have some contact information and some resources for how to find a genetic counselor that I guess can also be shared with your chat. For this one, you just type in your zip code. You can have a video visit to meet with the genetic counselor. And this just talks a little bit more about what we spoke about today. Like what is genetic testing and what's the point of doing it?
Nou gen de liye ke nou la, ke nou propose a nou men pou nou te ka konen lan zon kote nou ete, ki kote nou ka al fe test la. Nou vis pete kod postal nou, e pi deuxième parti an, se sa ke nou so diskute talè a, mwen mette li an pou nou te ka, si nou klike la dan nou ka jwen informasyon sa ou, pou nou te ka gen al notre porte. Merci Niki, merci bien
I'm
pou
gonna stop sharing.
uh,
Yeah.
merci pour présentation. Nous avons des questions de
Yes.
là où elle est. Première question, why is
Yeah.
it that black men are more prone to have prostate cancer?
Hmm.
Is there a
Yes.
historical explanation or is it something genetic due to our geographical origin or diet?
Yeah.
And
So, oh,
besides
sorry.
of testing, is there any other prevention that one can take, either pharmaceutical or natural remedies?
Yeah, so that's a great question. Some of it can be honestly a byproduct of systemic racism. I think that historically, Black people are less likely to get offered certain sorts of screening. They also might not necessarily have access to the same type of care in terms of the types of exposures that they can have. That also is something that is just a regional issue where there's like, again, like kind of lack of access. Other factors, there are some like hereditary or genetic factors too. We know that with women, they're also more likely to, Black women are more likely to develop more aggressive forms of breast cancer, and Black men are also more likely to develop exactly aggressive forms of prostate cancer. I will say, in my experience, also, I will agree that a lot of Black men tend to not go to the doctor that often, um, or maybe don't have necessary, there's like some medical mistrust that's going on as well, where they
Mhm.
might not trust going to the doctor. They might not want to get that screening done. Prostate exam screening is like a digital rectal exam, as well as a blood exam. Those are things that, aren't the most pleasant exams to have. And so that could also play a part too.
Okay. VUEO. I don't know if you heard, are you satisfied with the answer?
Mhm.
All right. We have before there is another question here, Nikki, but before we get to it, we have Period's hands that is
Mhm.
up. And then we're gonna take her and then go back to the question that we have here. Oh, he or she said he is satisfied. Okay. Period.
OK. Merci, merci, Niki. Information yo. Mais là, entendez, on est répétition yo bon. On dit que c'est, grand pile là, sorti dit déjà yo répété là. Donc, élève yo, je dis, même élève qui est intelligent, il a besoin de la répéter plusieurs fois avant de comprendre vraiment ça ça va apprendre. Donc, merci encore pour le temps et knowledge que vous partagez ensemble avec nous. Soit, ça que moi, j'ai plusieurs questions, oui. Yon la de yon ta reme pou ta defini sa yon rele triple negative cancer là. Et puis ensuite, est-ce que BRCA les pour filles et non filles et garçons?
Yeah.
Ah, OK. Et puis, j'ai besoin, alors m'a posé next là, et puis m'gen deux, trois l'autre encore, si m'gen temps m'a posé. Um, Genyen, combien fois on est capable de faire ça?
Yes.
Test.
Great question. So, triple negative breast cancer is one of the most aggressive subtypes of breast cancer because it doesn't respond to traditional hormonal therapy. So, if someone gets a diagnosis of cancer, usually there are these certain receptors or things that might drive the cancer, and that's how they might decide how they will treat the cancer. So, like estrogen or progesterone are things that could potentially drive the cancer. And so there are certain sort of like hormonal therapies that people can take. Whereas with triple negative breast cancer, all of those receptors are negative. So usually the first line of treatment would be chemotherapy. Obviously, chemo is not something that people like to have when it comes to cancer. But with triple negative cancer, that is usually the first thing that they go forward with. In addition, it grows at a slightly faster rate than we might expect for other types of breast cancer. There are certain types of breast cancer that might not require chemotherapy at all. They might just have different sort of hormonal therapies that you take. Um, but wouldn't require you to have certain sort of forms of chemo. Um, and then thinking about BRCA is something that impacts both men and both women. If somebody, just to kind of backtrack, we all have the BRCA gene in our body. I wasn't able to kind of do a genetics science explanation, but essentially, we all have genes, over 20,000 genes in all of our body. We have two copies for most of our genes because we get half of our genetic information from our mother, half of our information from our dad. So you get half your genes from your mom, half from your dad. We also have these genes that are known as cancer protecting genes. And when both of those copies work from your mom and your dad, they're able to do their job, they're fighting off cancer cells, they're protecting you. But if someone's born with one copy not working from their mom or their dad, that puts them at a higher risk to develop cancer because they have one less kind of soldier fighting for them to get it. They're left more vulnerable or susceptible to get cancer because this copy is not working. If someone has that one copy not working, let's say you're my mom and she had one copy not working, there was a chance that she could either pass down her non-working copy to me or the working copy.
Mhm.
So a 50-50 chance. And same with all of her children. So my brother, still that 50-50 chance that she could pass that down. And so there's no gender predilection. BRCA impacts both men and both women. And so it's important for all genders to get tested. If you're a man with a strong family history of breast cancer, that information is still valuable for you. And then the last question related to genetic testing and how often you should do it. Generally, we recommend having it done every like 7 to 10 years or so. Not because your genes change. Your genes are the genes that you're born with and the genes that you die with. But we might discover newer genes that we can test for. So 15 years ago, we were just testing for BRCA. And just kind of as a backtrack, BRCA is one of those cancer protecting genes. Um, but nowadays we have like panel testing where you can test for 15 different genes that are associated with breast cancer. And what we're doing is we're just looking at these cancer protecting genes. We're looking to see are both copies working from your mom and your dad. If they're not, that could let us know what we should do about it. BRCA is considered the highest risk genes that we know of, but there are other genes where the risk might not be as high as 87%, like we spoke about before. So depending on what gene is not working, the recommendations we might have would shift.
Okay. Thank you. We are
Merci.
taking one question. For the testing kit, the spit and the blood, do they have the same level of accuracy?
Yes, I would say the accuracy is the same. With blood, you can do like an extra layer of technology. It's called RNA testing. I won't go into like the weeds of it, but it's a little bit more comprehensive than, and we can only do that with blood. Also, when you do the saliva, oftentimes there are issues just because you're not supposed to eat 30 minutes beforehand, and you do have to spit a lot of spit inside of a tube. If there's any sort of contamination, they're not able to run your sample, and so there's issues. So that's why we say blood is a little bit more reliable because it's just a blood test and you're good to go. The saliva, you can't eat beforehand. And then there could be an issue with your sample. They could start running it. You're thinking your testing is going through, but there's an issue and you have to redo it. So blood is just a little more reliable altogether.
All right, thank you. Marlene has a question.
Well, thank you. Thank you, Nikki, for this wonderful presentation. A couple of questions. First, did you mention that the results, it takes about 2 weeks to get it?
Yeah. Yeah. Around like 3 to 4 weeks, but sometimes it does come back sooner than that.
Okay, good. And once you receive that result, do they give some type of recommendations as to what to do next? Are you referred to some oncologist or things like that?
Yes, exactly. So I have a ton of patients who are unfortunately BRCA positive, meaning that they were born with one of their BRCA genes not working. If somebody is BRCA positive, screening for breast cancer starts as a female, screening for breast cancer starts as early as 25. They would get breast MRIs annually. Once they turn 30, they get breast MRIs and mammograms every 6 months. There's a high risk for ovarian cancer, so we recommend them to go to GYN oncology. We do recommend preventative surgery, but because 25 is so young to have your ovaries and fallopian tubes removed, they meet with GYN oncology just to follow up with them, do imaging as needed. And then for pancreatic cancer screening, that starts at 50, where we would recommend they meet with a gastroenterologist. So we do have clear-cut recommendations for the majority of these genes that people are tested for. And there are things that we can do about it, and as well as there are like specialists that are familiar with like what to do about it too.
Thank you.
Mhm.
Yeah, now, what are the risks? Well, si par exemple, yon moun, un jeune moun, a Dieu ne plaise, ou même par exemple, yo jwen nou pozitif pou BRCA, eske gen posibilite kom ou poko enfante pou un moun ki lan situasyon sa ka fet ti moun? Eske, ou di mwen se eske osito le un jeune patient konen ke li gen, swa ke li gen ou bien li gen high risk pou gen, ki sa ke moun medikal la fe pou ede si yo ka ede.
Yeah, so a lot of I actually had a patient who was born 4 days after me, diagnosed with triple negative breast cancer. So she was like 29, diagnosed with triple negative breast cancer. And that was just like obviously like very emotional to have her as a patient. And we're both so close in age, but obviously a lot of things shift. you have to think about a ton of things. One, if you already have a diagnosis of cancer, there's like egg preservation. So you have to like preserve your eggs. If you're going through chemo, that can like impact your fertility. If somebody has a genetic predisposition to get cancer, unfortunately, we can't do gene editing. Again, there's just that 50% chance unless people decide to do IVF. So in vitro fertilization coupled with genetic testing for your embryos. It is a very expensive process if you don't have like most insurance doesn't cover it. Usually it can run people anywhere of upwards of like $20,000 to do this, where essentially you're taking the egg, you're taking the sperm, you're putting them together in a petri dish, and then you're testing however many embryos that you can get to see do they carry the BRCA mutation? Do they have it or not? If all of them have it, then you don't implant them. But if you select ones that don't have it, then you implant those back into the woman, and then she would give birth to a child that does not have BRCA. If that child doesn't have BRCA, it does not skip generations. Once it stops there, it stops there. So there are families that I've seen where a mother has a very strong family history of breast cancer. She has BRCA, but she doesn't pass it down to any of her kids. So it stopped there and it's random. It's 50-50. It's like flipping a coin. But there are other situations where I've seen like a mother or a father and they've passed it down to all of their children, in which case, it'll just keep going down unless like some of the siblings don't have it, in which case it wouldn't go down that path. But the only way that you can necessarily for sure prevent it is through IVF. And then there's a process called PGTM where you're just testing the embryos to implant ones that don't have it.
Mwen lot question, eske gen yon, is there a time limit once, depi konon gen BRCA, eske ou ka di, ok, nan tel, lan 2-3 mwa, lan 1 an, lan 5 an, wap ka devlope kanser lan, eske nou ka dekouvri sa ou bien eske lon moun ki genyen, lon vin dekouvri li BRCA positif, kome tan ke moun sa genyen pou te ka potan kod pense que li en sécurité, li safe avec santé.
Unfortunately, we can't predict that. There are families like with BRCA where you see, like I had a family where there were 7 sisters. All of them had breast cancer. All of them were BRCA positive, and they all had breast cancer. I've seen other families that are also BRCA positive where there's like one person in the family with breast cancer diagnosed in her 70s. So it's really kind of hard for us to predict. It presents differently in different families. We assume that with age, your risk gets higher because you have that genetic risk coupled with the aging risk factor as well. Those things are compounded and raise somebody's risk to get cancer. But even still, there are cases where, the patient I had who was 29 and had breast cancer very young. So we don't know. There are some papers that we reference if like I have a patient that's BRCA positive. There's like these research studies that it looked at like 10,000 women who are BRCA positive to see by decade of life what was their risk to get cancer. And so we sometimes use those papers, but they're not perfect. And it only like usually a lot of research is focused around white European women. So who knows what other factors affect Black, like they're not diverse groups of research pools that we're looking at. So unfortunately, we don't know for sure, and we wouldn't be able to say if you'll ever get cancer at all, because again, 87%, the highest likelihood is you'll get cancer, breast cancer, but there's still that 13-15% chance that you don't, and we don't know if you'll get it or you won't.
Okay. Perrette? Perrette?
Oh, you're muted. Oh, yeah.
Okay. All right, thank you. Again, question que me gagne, merci pour toute belle information ça pour continuer à partager ensemble avec nous. Alors, je devrais remercier parce que on suggestion ça fait là, on dit que c'est la période Thanksgiving nous c'est moment comme si famille rencontrer avec famille, donc il est important pour nous capables de connaître si c'est le moment pour nous capables de partager information dans notre famille yo. Il y a un problème qui gagne dans la communauté, nous c'est que nous pas parler genre de bail ça. non kembe secret, on sait de bagay, ou bien conseil de maladie, moun pa pale yo, parce que sou pale yo, gèle la pi vin pi kontaje ke jante kontaje deja. So, alon pa konen ki sa, ki analyse ki fet de sa yo, men li important vraiment pou nou kapab pran e konsey sa yo, a tout moun ki la yo, e puis ese fè konversasyon sa yo nan fami, non? Et puis, on l'autre bagay, moi, te vle di ankon ou pale de li, se life insurance que moun gen doit pas ka jwenn une fois que fini gen yo vi diagnostike yo avec genre de problème ça yo. Parce que dans questionnaire pour poser yo gon question qui m'a ça, est-ce que parents t'es mort à un jeune âge avec cancer ou bien avec problème cœur? Alors gen moun gen a décidé de dire gen doit répondre n'importe qui genre, mais une fois que il a fait investigation, il a réalisé que son mention te bail ou déjà pas gen même l'autre avait mourir pour te fin dire que éligible yo ba roulé, mais une fois que yo vinn ouais comme si sou mourir tout de suite après ou bien 1 an ou bien dans 2 ans avant que ouais, la vini comme si yo vinn pas ka faire rien encore 2 premières années ça yo si on mourir la donné ou gagner chance pour yo pas pour yo juste remettre tout comme te payer yo pas payer couverture pour parce que on te pas menti qui était volontaire si on te déjà connaît déjà donc alors c'est ça me devait additionner là-dedans mais qu'on y a là maintenant question moi c'est qui ça ou capable attendre le yo référé ou yo mode pour faire un breast MRI.
Yeah, so breast MRI is really the most sensitive screening tool that we have for breast cancer. They're the most reliable. They're a little bit better than mammograms. They're better than ultrasounds in a lot of ways, which is good. But because they are so sensitive, sometimes they can pick up on things that are actually nothing. And so, sometimes you might get a breast MRI, get a breast biopsy as a result of it. And, breast biopsies are not only like painful and uncomfortable, but they can cause a lot of anxiety. It can take some time for you to get the results back. Some people have just like cystic breast or other things in their breast that might warrant them to get multiple biopsies, and that can kind of cause some anxiety. I do think breast MRIs truly are the most reliable breast screening tool, just with the caveat that um, you can kind of sometimes pick up on too much. But yeah, I also agree with what you're saying in that, a lot of people are reluctant to talk about cancer. And I think that's like a historical thing, but cancer is no longer a death sentence anymore. A lot of people do end up, unfortunately, passing away from cancer, but truly, if we also look at the statistics more largely, the majority of people do end up surviving a diagnosis of cancer. And so it's something that can be so valuable for, I have patients who aren't telling their children or their siblings or other people in their family. And that's a personal decision for sure. There's reasons why people decide to do that, but I do think that it can be helpful for people to just be aware of what's going on in their family history because it can, help inform their own health.
All right, thank you. Parce que gen moun ki kon vini, alors moi interprète en pile pour conseiller génétique yo. Ça veut dire comme si
Oh, cool.
moi m'attendais, moi m'attendais
Yeah.
conversation ça yo. Yeah. Donc on li bon pour nous capable faire genre de conversation ça yo dans la famille parce que you never know, you never know.
Yeah.
Nous capable nous capable bénéficier de lui. Moi
As
gen l'autre mec qui lever.
Marlène,
Yes,
ok,
Vicky.
mka just fon sujesyon an Sidaniki, pose ke m voye link lan bay 2-3 moun, mwen yo monte, yo pa pale kriol, si nou te ka, sou te ka tradwi kesyon yo, s'il vous plaît.
ok.
Moun ki pale en créole yo pour question traduit en anglais. Is that what you said? Okay.
Moun ki pose kesyon an kriol, si asit ka tradwi an anglais pou moun yo, s'il vous
Ah,
plaît.
d'accord.
Yes.
Vous ne parlez pas créole?
M'a
Yo pa
pose
pale
papier
kriol.
libre.
Oui, vous parlez créole, ok.
Ou pas besoin de traduire pour moi, Astrid.
Oui.
No, je blague. What was I gonna say? Okay, it seems to me that there are more cancer cases today that there were few years back? Is it just an impression, or is it related to what we're eating, or is it because there were not enough testing in the past? Like, what's your take on that?
Yeah, that is a great question. I do agree that like not only are there like more cancers, but just younger ages of diagnoses as well. I do think a lot of people might have been diagnosed in the past, but we just didn't know. It wasn't until recently that even like regular mammograms or colonoscopies became a thing that like your primary care provider was supposed to tell you about and you were supposed to do, or that people were aware of what are some of the side effects that could happen to lead to cancer. So if you have blood in your when you use the bathroom and poop and what that could potentially mean, or if you have like like blood running from your breast, like what that could potentially mean. These are things that oftentimes people used to ignore in the past and would not necessarily like receive care for. I do think a lot of it can be environmental too. I mean, even now, like we think about, particularly in like New York City, like public schools, like a lot of the schools had like asbestos and like other things that they would just like build houses with, or things that we now know cause cancer, but we didn't know in the moment. And we were just using these products pretty flippantly, or just like everyone's home had it, or they had these things, or even getting perms regularly, certain sort of baby powders, these things that were just kind of commonplace that with time, now we have realized can put someone at a much higher risk to develop cancer. And even within the past like 30 years, like microwaves are a thing, iPhones are a thing, AI and how that, and like global warming, all these things are compounded that we haven't had enough research or time to see the long-term effects of this. We're only just like seeing all the new cancers and we don't necessarily know why. So I would assume with time we'd be able to kind of pinpoint what is the reason or the source to all of this stuff happening. But I do think the numbers are alarming. I think our food is generally a lot less healthy. Processed foods are very, very common. Um, and just the way that the world is moving, it almost seems like inevitable that this would happen, unfortunately.
An kesyon ke mwen, well, petet m ka tradwi, men ki dem di nan kreol, nou konen ke an pil konen nan, an pil medam, san petet yo pa gen rezon medikal, yo al fe breast implant. Mais quelque chose ça te caille. Est-ce que genre de bagay sa yo, m'pa konen si nou gen assez de données pour nous ka fon déduction sur yo, mais est-ce que genre de bagay sa yo, you not cause qu'on monte ka gen breast cancer? There are many, nowadays, many people, they are having any type of things done to their breasts, whether, just for beauty or what have you. Do you guys have, does that have, or does does that have an impact yet, or will it eventually cause something that we don't know yet for breast implant without whether it's medically necessary or not, or those type of things, do they affect our bodies in a way that can lead eventually to some type of breast cancer?
Yeah. I think foreign objects can put your body at risk for certain sort of infections, but I mean, even if like women who have breast cancer and like let's say they get like a double mastectomy, so both of their breasts are removed because of the cancer, or just like a single mastectomy, oftentimes they do get reconstruction and, plastic surgery where they might get an implant. And
Mhm.
so for this high risk community, they are getting implants. So I would assume that it's not contraindicated, like it's okay. And typically, I believe they are saline implants. I think in the
So, sorry, what
past,
type of implants? Saline?
like saline, yeah, which is just like
Mhm.
salt
Mhm.
water, like implants. Um, But I don't think that might potentially put someone at a higher risk to develop breast cancer. There are patients that I know who have a genetic, like they have a BRCA mutation, and so they preventatively have both of their breasts removed. They don't have cancer. They just know they're at this high risk to get cancer, so they remove both their breasts and they get implants. And so that's also not like a bad thing to do, or it's not something that's not recommended for this group of people to do, even though they're at a very high risk to develop breast cancer. And so I don't think that there is any issue with them getting
Could it be that it's not yet known, or is it a fact that whatever that is, as I said, it can be medically necessary or
yeah.
otherwise.
Yeah, I
So
mean, I think for the most part, it's usually like cosmetic. Like, I don't really think it's ever necessarily like medically necessary for anyone to have like a saline implant. It's usually just like cosmetic because they want their breasts to look like how it looked like before or similar to how they look like before. I would say the only thing that like breast implants might obscure is breast imaging moving forward. So like you getting a mammogram after, like people get breast cancer after having breast implants. And so the breast cancer can be like behind the implant or something, and it could be obscured from traditional breast imaging. So that would be an issue, but I wouldn't necessarily say that there's like a direct, like one-to-one correlation between the two,
Mhm.
um, between getting like a breast implant leading to breast cancer.
Yes. Uh-huh. Okay, thank you. Any other questions? I don't see any hands. Oh, yes, there is
I
a
do have a
hand.
question. Okay, go ahead.
Period. And then you'll
Uh,
go, Joanne.
Now,
Period.
I asked many questions, so you can go ahead, Joanne.
I do have a question, and someone who had a breast biopsy, do you think that person is at risk of having breast cancer, or that person should have genetic test done?
Yes, great question. Breast biopsy, they're not super common, but a lot of women might have had one in their lifetime. It really kind of depends what comes back. So you can get a variety of different results from a breast biopsy. So there's things called like fibroadenomas. There's other things, like PASH is like another sort of like medical thing that can come from like the breast tissue. There's atypical ductal hyperplasia. There's certain things that might put someone, depending on what we see in your breast, like if there's some atypia or something that's not normal in the breast tissue, that might over time, if not checked for, can put someone at a higher risk to develop breast cancer. So it kind of depends on the result of the biopsy. Some people might just have like dense breasts, something was picked up weird on the mammogram or the ultrasound. And so they did, imaging, but it was just benign breast tissue, in
Mhm.
which case we wouldn't think that puts you at a higher risk. Um, but generally, denser breast kind of slightly raises somebody's risk just because it can be like a little bit obscured in the imaging, but it really depends the results of the biopsy. So like anything that's like atypical would likely warrant you having high risk imaging because your risk for breast cancer over the course of time can be slightly elevated.
Okay, period.
Thank you, thank you. My question now has to do with men. We have men on the line with us, and what advice would you give to the men? I know they don't like to. A lot of them don't like to go to the doctors. Yesterday, I was talking to a lady, and I made this statement, and she said that, well, I am the one who doesn't like to go to the doctor, but my husband does. So I'm like, wow, that's, well,
An
bravo.
exception.
Bravo. Yeah. So, and now they don't like to go. And now we're talking about having the prostate, having someone check for them from the prostate to see whatever they think is an invasion of privacy. So how would you advise these people so they can see it differently?
Yeah, truly, I feel like health is wealth. Oftentimes, like same with my patients too. A lot of the men, they come with their wife, and the wife knows more about their health history than they do. And so we're asking even about family history sometimes, about their own family, and the wife is the one answering questions. I think it's really important for people to be aware of their health. Um, just because you have so much control when you know what's going on. I think it's also important to find a doctor that you like. I think that plays a big part as well. Sometimes people will just continue going to a doctor just because they think they have to. But you can shop around. You can find like a urologist that makes sense for you. You can find a GI doctor that you like and enjoy. If it's somebody black, you can look for that. There are all these different sort of apps and things that you can find healthcare with where you can kind of specialize what sort of doctor you're even looking for. And if you like a particular doctor that you already have, you can ask them for a referral. Ask them for, hey, I'm looking for a doctor that does this. That's to kind of get someone that you can trust. Um, I think oftentimes when you have like a doctor or medical provider that looks like you, sometimes that can be helpful for some people. So maybe a black man needs a black male doctor. Maybe that would make a difference. Just having someone that relates to them. But yeah, truly, I think particularly with prostate cancer, it's one of the cancers that's usually pretty slow growing. Although I mentioned with black men, they can have more aggressive forms. It's one of the better cancers to have in the sense that the survival rate is pretty high for prostate cancer, generally speaking, and usually might not involve any sort of surgical intervention. Um, so yeah, I would just say catching stuff early makes a world of a difference, and so just go.
Any other questions? I see someone's name, Nikki, is amazing.
Bonzo.
Okay. Well, I do have another question. If, based on what you said, it just the margin is very small to detect or even know if somebody is at risk. Uh, is it since is it really necessary for someone to go get tested? What about the majority of you won't know anything? How
Yeah.
important, I mean, is it really necessary?
I think it's very necessary only because you don't know until you know. Like I did mention that these are the things that make us suspicious, so young ages of diagnoses, other things like that. But I have had patients who do genetic testing and they come back with something positive with no family history of cancer. I have a woman who was diagnosed like in her 60s. She has four sisters, five brothers, no cancer. They're all well into their 60s, 70s. Her parents didn't have cancer. No one had cancer. And she came back with a high risk gene. And so that kind of changes her management. It changes what sort of surgery we would do for her. At this point, genetics is still relatively new. Like we haven't been doing this for 100 years. We've been doing it for like 30 years.
For how long?
Like I would say like 30 or so years, genetic testing has become a little bit more commonplace. So um, it's very important to get testing because you just never know. There are cases where I'm shocked by the results because I think, no, the testing is going to be negative, and they come back with something positive. And it can just it benefits you so much, and there's almost nothing to lose from it. I just think it's worth doing. Because if you do know, again, there are things that we can do about it. Cancer is scary. It's a very traumatic experience, not just for the patient, but for their family, for their friends, their loved ones. And if there are steps that we can take to prevent or lower or address that risk, then I think it's always worthwhile to take it. Even if it's 5 to 10%, again, we've only been doing testing for 30 years. Maybe that number is actually much higher. Not a lot, most people have not done genetic testing. Like, I'm sure the majority of people here have not had cancer genetic testing before. And so, it's possible that, someone here in this group has, contact one of the mentioned companies about referrals. Yeah, so I would say it'd be best to reach out to the Find a Genetic Counselor link, just because they would usually order the testing for you. For any of those labs that I mentioned, they do have to be ordered by like a medical provider, so you would need somebody to do that for you. So it'd be good to just reach out to the Find a Genetic Counselor link, talk to somebody, get that information, and then move forward with testing. If you're in New York or New Jersey, I'm happy to see you.
Ok, nous avons notre question de Madame Isaac.
Mettez une question dans le chat là, oui, de Joselaine.
Uh, Hold on. I think it was answered. Est-ce que yon kou nan tèt Ou eske on moun ki yo frape yo lan sen, yo lan tete yo, eske sa seulement ka koze pou moun gen kanser?
Yeah, that's a common thing that honestly I've heard some of my patients say, but biologically,
Can
no.
you translate the question in English?
Oh, yes. Like if somebody was hit in the breast, could that put them at a risk to develop breast cancer? And I would say no. Again, cancer is caused by that uncontrollable growth of cells, so a mistake with something happening. So we don't think just any sort of like impact or direct trauma would necessarily cause that biological or like cellular issue. Um, so we do not think so, that that is the case.
Ok. Jocelyne, ou pa bezon traduksyon, pa vre?
Okay, thank you.
Merci. Madame Isaac?
Oui, Nikki, ça a été merveilleux. J'ai eu l'opportunité, j'ai l'opportunité pour m'étendre depuis au commencement. You can translate that after.
She understand.
Um,
She
I
know.
know.
She went to a French school. She knows some French. She understands.
okay. But you can translate for those who don't.
Yes, it
Who
was a
don't speak.
pleasure for me too, because I've been here listening to you from the beginning.
Okay. Ma question est celle-ci. Pour qui ça, les médecins sachant, par exemple, pour moi-même, I'm going to take my example. From my father's side, we have a lot of case of cancer. Um, Breast cancer, toutes sortes. La gorge, poumon, many. And I have my brother who still alive. He has prostate cancer and colon cancer, and my sister has colon cancer. My physician, he knows my story, but he never referred me to have that kind of genetic test. So what shall I do? Should I go to him and ask him to refer me for a referral?
Yes, 100%. It's really sad, but as I was mentioning before when talking about like prostate cancer, like historically, Black women are under-referred to receive genetic testing and counseling and all that type of stuff. So, that's why like awareness is so important so that you can bring it up to them. You can say, I want to meet with a genetic counselor. If you live in a major city, there should be access to genetic testing, genetic counselors. Some doctors order it on their own, but some have genetic counselors at like the hospital. Especially given the fact that you have two first-degree relatives with colon cancer, you would benefit from having genetic testing.
Okay, something else I forgot to mention. I'm not young, I'm 77. Is it too late?
No.
Oh,
No, because typically for colonoscopies, they stop at around 75. But just if you have something genetic, then we might continue to do colonoscopies for so much longer. And even still, just based off your family history alone, you might still warrant getting colonoscopies more often and even post when it sets a stop for the general population because it seems like your risk might be higher than the general population.
okay. Thank you.
Mhm.
Bon, now, mwen konen ke gen fi gen se de hormone ke yo pa produ anko apon certain âge, right? Now, eske si hormone sa yo pa produ yo, et puis eske li nécessaire pour peut-être, par exemple, on dit que après un certain âge, quand on fait que se dit Madame Isaac, yo pa recommande encore. Si yo pa produit hormone sa yo, est-ce que yo supposé, parce que c'est hormone sa qui te ka cause cancer là, est-ce que yo
Mhm.
supposé al fait test pour cancer là? De toute façon, anyway.
Yeah, just because you have so
Pose
much
question
like,
en anglais.
oh, so uh like after you go through menopause, or
Mhm.
your hormones just stop producing the same, like would it still make sense for you to undergo genetic testing because most of these cancers are um, driven by these sort of
Mhm.
hormones. But yes, it would. Most breast cancer occurs after menopause anyway, just because of the lifetime exposure that we have had to estrogen, progesterone, etc. Um, and so it definitely, you still would benefit from having genetic testing if you have postmenopause, if you're after menopause, if you have a postmenopausal breast cancer, all those things still could benefit from genetic testing.
Ok. Ok. Mm. Alors, I'm mindful of the time. It's 8:12. I'm not sure if we have
I
someone with
have,
a question. Yes.
I do have a question, but it's not about cancer though. Can I still ask her?
Yes. Yes. Hopefully she
It's
should be
as
able
a
to
Christian. Is
answer.
she a Christian?
Yeah.
Nikki, you are a Christian. Okay.
Yes.
Yes.
It's about stem cell,
Stem
Stem
cell.
cells?
Mhm.
stem cell.
Mhm.
Hmm.
Do you advise a Christian to do that? To
To like have stem cells to use it.
uh-huh.
I don't even know how stem cells are actually being used right now in medicine and if it's
Okay.
even fully like legal in some places. I know like there's
Okay.
a lot of research related to stem cell research, but I don't know in what settings it's actually being used. I think the majority of stem cells can be taken from the umbilical cord as well as like
Ooh.
I think deceased babies. I'm not entirely sure, honestly. I don't know too much about like stem cell therapy, but um yeah, I think the majority of stem cell research is used on like a research basis, at least in the US, from my understanding, but I'm not entirely sure like the extent of it. Um, but I think if it's something that could potentially help considerably, then I wouldn't necessarily be opposed to it, depending on how the stem cells were, like where they came from, basically.
Okay. Thank you.
I am taking one last question from Luthers Dupont. And after that, Nikki, if you have a last word, we'll take it from you and then we will finish. Luthers,
Thank you. Good evening, everyone.
good evening.
Thank you, Nikki, for your presentation. I would like to know if the size of the breast could be considered as a risk factor for breast cancer.
Yeah, great question. Yes, I think the size of the breast does play a factor. Also, like the density of the breast, can also play a risk factor too if someone has like very cystic breast as well. Again, I don't necessarily think it is like that one-to-one thing, is if you have big breasts, if that puts you at a significantly elevated risk, but I do think it can be a risk factor.
I'm
But I think
sorry, I'm sorry, the size, like bigger or smaller when we talk about
like
size?
bigger. I was saying like bigger, yeah.
Mhm.
But I mean like there are women with very like smaller breasts that still have breast cancer. So that's why I'm saying it's like it's difficult with cancer because there really isn't a one size fits all. There are people who have never smoked a cigarette in their life and end up dying from lung cancer, and someone who has smoked cigarettes for 40 years and, never gets lung cancer. It's really kind of hard for us to really predict all the time why and how it might happen. But cancer largely is just multifactorial. So just meaning multiple things come into play and can lead to someone getting a diagnosis, which is why genetics is a small piece of that puzzle, but it can really just shift a lot for you overall. So I do think it's still worthwhile to pursue big breasts, small breasts, men as well. Men can get breast cancer, especially if they have a BRCA mutation. Um, so yeah, it can be a factor, but I think maybe density of the breast might be more of a telling factor too.
Thank you.
Mhm.
Well, I see the hand of Madame Isaac. That's the very last one.
I know. Um, since cancer is not curable, so why take so much caution or go for prevention to know in advance? You have it, you're going to die anyway. This is something you cannot prevent. You cannot cure actually.
Yeah.
So um what
Like,
is your
what's the point of
advice?
doing this?
It will hmm?
Like, you're asking what's the point, like, of doing.
Yes.
Yeah. Well, I mean, cancer can technically be cured. There are people who, have cancer, they have surgery, they found it very early, they just removed it. They're maybe on some hormone therapy for a few years afterwards, and then it never comes back. And that would be considered somebody that is like cured from cancer.
What to show yourself?
But, I really do think it just improves your outcomes. That is the point of getting mammograms. That's the point of getting colonoscopies. That's the point of all this stuff because if you're getting this stuff regularly, we find it early. We can't necessarily prevent you from getting cancer or not. That's something that is just beyond our control. And someone will get cancer whether or not you're doing everything right or you're doing everything wrong. That is something that we cannot control. But
Mm.
we can hopefully control the treatment, how exactly we approach dealing with this cancer. And when someone catches cancer much earlier, there's usually just a lot more that we can do. It can really make the difference between life or death, oftentimes, is if we got a mammogram earlier or if you didn't skip the mammogram. Like, I've had patients I have a patient, her husband, she was recently diagnosed with triple negative breast cancer, and her husband was just diagnosed with stage 4 bladder cancer 3 weeks before her. And so she's treating her husband, taking care of him, and she wasn't going to get a mammogram because she had so much going on. And she decided to get a mammogram and found out that she had triple negative breast cancer, but it was
Oh,
so small that she didn't even have to get chemo first, which is typically what we do with triple negative breast cancer. And instead, she just got surgery and will have radiation after the fact. So it can really kind of shift things considerably. Like, don't skip the mammogram, don't skip the colonoscopy, don't
okay.
skip the pap smear, don't skip it. Like, I
Mm.
think, sometimes all it takes is like a few months or a year to where something pops up. And truly, if we find it earlier, it improves your outcomes by a very, very, very large margin. If she had waited another year because of her husband's diagnosis, her outcomes would have been considerably worse. And
Mm.
so really,
Mm.
the point is to get it early.
Thank you.
And I can vouch for that because my grandmother was diagnosed on my dad's side with breast cancer when she was in her 40s. She got treated and she died when she was 95, not of breast cancer, but she lived, a long life until at 95 years old she died. But thank you, I want to say thank you. Moi, je voulais dire tout le monde merci qui t'a participé activement ou pas. Et que à Niki spécialement, merci. Merci que vous êtes disponible pour te partager connaissances ensemble avec nous. Nous comptons et nous promettons, moins promettons, pour mal faire, pour mal faire genetic counselor. Malheureusement, pas après moi, pour faire pour moi, mais I'm gonna do it. If you have one last word to say, we will take it from you and then we're gonna have finish if you have something else to say.
Yeah, just speak to your family, get that information, be open to talking about it, be open, tell your doctors about genetic testing. If that's something that you want to do, tell them about it. Mention it to your GYN, mention it to other people. We want to maximize our care and take care of ourselves, and knowledge is power.
Thank you. Thank you. Thank you. Bravo.
Yes, bravo. Thank you. Merci.
Merci.
Tout fort.
Bravo. Oh,
Bravo, Niki. Pour nous finir, nous avons Claudel qui a fait des mots de remerciement et puis prière, là. Prière finale. Claudel?
Merci à vous tous. Nous t'es vraiment rester assidus pour nous capables d'entendre Niki et Astrid Vertus qui t'a translate pour lui. Pour moun qui part là depuis au début, Véronique ou Niki, Delva, c'est petite Astrid. C'est deux complices qu'il a. C'est la mère et la fille. Donc, on nous bat encore, nous voyons dans sous chat là, nous sommes capables de voir cœur, bravo, tout ça pour eux, parce que vous fait un good job. Et nous remercions tout le monde qui a participé. Nous sommes 30, à la dernière minute, nous sommes 30 sous Zoom, non? Et nous disons merci pour cela. Tabitha toujours un sujet palpitant d'intérêt. Et c'est ça fait que m'intéresser pour nous capables de monter chaque samedi soir à 6h30, excepté le premier samedi. Sujet toujours intéressant. Nous intervenons sur plusieurs sujets. Par exemple, étiquette, alors, savoir-vivre, santé, et puis ça qui passé dans la famille, nous, violence, comment pour nous capables de vivre avec petit nous, un bon sujet que je connais qui intéresse nous. Pour cela, je invité nous chaque samedi. Et là, venir, pas venir pour compte nous. Inviter d'autres amis, venir en foule pour au moins, si nous tous gagnons même information, peut-être, me dit, société côté n'a vivre là, communauté côté n'a vivre là, il y a des changements parmi eux. Merci encore d'être venu, merci encore pour persévérance nous et n'a coupé tête nous pour nous capables de prier. Notre Père des cieux, nos âmes te louent et te bénissent pour les multiples bienfaits dont nous sommes l'objet de ta part. Tu as été avec nous pendant ces heures passées à entendre Niki pour ses conseils. Permets, Seigneur, que nous capables de mettre tout ça en pratique dans la vie. Nous. Permettre que nous ne pas rester têtus à ça nous tendre. Pour nous capables d'aller faire des recherches, aller tester, demander plus d'informations pour que Seigneur nous capable inculquer à amis, nos parents, nous, pour nous capables pas victimes d'une série de problèmes. Encore une fois, bénis-nous, bénis nuit là pour nous, bénis toute semaine qui ouvre devant nous, permet que Seigneur nous capable passer une très bonne semaine. Et déjà, nous pensons que nous passons un très bon week-end parce que nous tous avons rencontré avec famille, nous, avec petites nous, qui étaient loin de nous. Permet que Seigneur, week-end ça, week-end de retrouvailles ça, permet que Seigneur nous capable bien passer. Vous Esprit Saint pour capable garder nous. Vous Esprit Saint pour capable garder Niki, pour capable garder maman, pour capable garder tout le monde qui était sous chacun ainsi que famille nous. Toute grâce à nous demandons, non en raison de mérite personnel, nous n'avons pas gagné. Mais c'est au nom de petit tout Jésus, à lui soit la gloire dès maintenant au siècle des siècles. Amen.